Okay, well, I think we'll get this little webinar presentation started here. I want to take just a second to say thank you for everyone who is out there watching this right now. My name is John Kihlken. I'm a physician here at the Franciscan Neuroscience Spine Specialists. I just finished my 5th year of practice here. I did my med school at the Indiana University School of Medicine, and did an anesthesia residency at Indiana University as well, and then my pain management fellowship down at the University of Louisville. All right, next slide, please. So the first question is, what is a pain management specialist? Well, as I just mentioned, I was trained with a background in anesthesia, but then I went on and did an extra year of training to sort of focus in on excuse me, chronic pain management, and particularly spine conditions and how to treat conditions such as spinal stenosis. So I'm trained to evaluate, diagnose, and treat all different kinds of pain, including spine pain. I can treat sudden pain, but in particular, I have an interest in chronic pain or pain that has been present for months or even years. The goal of my practice is to reduce the severity of pain and improve quality of life. That means different things to different people, but that's part of the conversation that we have if you come to visit me in the office. And I have advanced training in minimally invasive procedures and therapies to help reduce pain. Next slide, please. So if you're joining this webinar, you may have asked some of these questions, so you can kind of go through some of these. So this may be something you have thought or said, my sciatic pain in my legs is so severe that I couldn't walk more than 100 feet without having to sit down. I can't get through the grocery store. One thing that I hear very commonly is people say, if I'm out and about anywhere, the first thing that I do is I'm looking for a chair to sit down in. I got to know where, I can go take a rest to get the pressure off of my back. Particularly if you have pain when you are standing and walking that is relieved with sitting or bending forward, that can be indicative of a condition called neurogenic claudication, which can be from spinal stenosis. And that's really the focus of today's talk, is to kind of introduce some of the treatment options available for spinal stenosis and neurogenic claudication. Next slide, please. In the treatment of spinal stenosis, we usually try a variety of options. So this ranges from very conservative treatment like physical therapy or medications. Some people use opioids. There's sort of a next level of invasiveness with epidural steroid injections or different types of injections. Sometimes we even burn the nerves. That's called a radiofrequency ablation. Sometimes we use fancier devices like spinal cord stimulators, and some folks even go on to have surgery in their back. Next slide, please. Lumbar spinal stenosis is a very common condition. Many people have it. It can result basically just from the wear and tear on your spine that just comes from everyday living. Usually what I say to folks is arthritis no one is immune to arthritis. Everybody gets it. Some people get it a little earlier in life, some people a little later, but everyone gets arthritis sooner or later. So lumbar spinal stenosis can be the result of just your wear and tear and aging process. Over 14 million Americans have lumbar spinal stenosis is present in 14 million Americans. It's most common in folks over the age of 60, and it is the #1 reason for spinal surgery in patients over 65 years old. If left untreated, it can worsen over time and significantly impair activities of daily living and mobility in patients. Next slide, please. What is lumbar spinal stenosis? These pictures on this slide are showing you some of the things that happen when you have stenosis. Stenosis, the word itself just means a narrowing of a hole. So your nerves in your back run up and down through your spinal canal. And if that hole gets narrowed, and it can be from a variety of reasons, either arthritis in your facet joints or a bulging disc, or other reasons like a cyst or something like that. But if that hole gets narrowed, the nerves that come out of your back can become irritated. And when that happens, you can experience things like pain or numbness that can run from your back and even affect your legs, run down your legs. One of the important things to figure out in this situation, or for someone who has spinal stenosis, is can that pain be relieved by bending forward or leaning forward? And is there a difference in the posture of the patient with regard to their symptoms? Next slide. If there is a difference, depending on what position your spine is in, there may be a solution for that, or a procedure, a simple procedure that can help out with that greatly. And that is the Vertiflex procedure. This procedure is a minimally invasive treatment that has been shown to give effective long-term relief. It is FDA approved. It is a surgically implanted device. However, it is minimally invasive. Usually the incision for placing this device is about 1 inch long, so very small incision. It's an outpatient procedure, which means you do not have to stay the night in the hospital. Patients go home the same day. It does not require any extensive tissue removal or commonly folks think of back surgery and they think of screws or plates or cutting bones or muscles. There's really none of that that needs to happen in order to place this device. It's a relatively fast recovery time. There's low risk of infection or any other complications, and it can help for a long period of time. This has been studied for years after placement, and it has given long-term relief. Up till, I guess, since 2016, there have been over 10,000 patients treated with this. This diagram that you're looking at on this page is really just designed to show you the Vertiflex device in place. As you can see, it's in the picture on the right. It has those little kind of purple feet and then a metal spacer. And the point of that device is to essentially prevent your spine from pinching down on nerves that are already pinched in your spine. Next slide, please. This video is kind of a short clip of showing how the device is placed between the spinous processes in the lumbar spine. It's going to run, I think, over a few times, so you'll get to see it a few times. But you can see that it really doesn't take a very large incision to place this device. About 1 inch, like I mentioned before, will allow you to get that in there. Those little feet open up, and then we kind of slide it into place, and that's the end of the procedure. It typically takes usually about a half an hour to do this surgery. Once the spacer is placed, again, the idea is to decrease the pressure on the nerves and allow your body to have a mobility back without crushing those nerves like it had in the past. Next slide, please. So what to expect after the procedure? Certainly everyone is different, and will have different requirements after surgery, but in general, and this slide is a little bit different from what my practice is. Actually, I personally ask you not to shower for 1 week after the procedure. You will have a bandage on your back. I use suture or stitches that goes under your skin and will be absorbed. And so there won't be any stitches that need to be taken out or anything like that. But I do ask you to wear a bandage for 1 week and not get it wet. So no showers for 1 week. Then for 4 to 6 weeks after the procedure, we really need that device to have a chance to kind of heal into place. And so we ask you not to lift anything over 10 pounds in weight. We ask you not to bend or lift or twist really anything substantially. I do have you place an abdominal binder over your abdomen just to kind of remind you that we don't want you making any twisting or bending type of movements. Walking is just fine. You'll be able to go home, and most people, basically will just have a little bit of soreness at the incision site that may last a few days. But once that heals up, that's really about the extent of the recovery. Once the pressure is relieved off of that nerve, oftentimes folks will be able to stand up straighter. They'll be able to walk further. And so if they haven't been walking for a long time, sometimes they need a little bit of reconditioning, or it may take a little bit of time to rehabilitate those muscles that haven't been used in such a long time. And so we sometimes advise a walking program, or even sometimes go to physical therapy to rehabilitate muscles that haven't been used in a long time. Next slide, please. So does the thing work? Yeah, it works. There's been lots of studies, and in my own personal practice, I've seen this happen multiple times, where people who have lumbar stenosis and aren't able to stand up straight or walk very far, we put this device in, we relieve the pressure off the nerve, and they can walk, and they do have a reduction in their back and leg pain. So in some of the studies, 9 out of 10 patients said that they were satisfied with this procedure. 85% of them decreased the amount of opioids that they were taking. 81% of them improved their physical function. 75% reported a reduction in leg pain symptoms. This is out of a 5-year study. And so these numbers are showing durability of the treatment as well. And then, of course, we have some individual patients here who have had success. So Gloria, who's 75 years old, said the day of her procedure, she went to visit the butterfly park in Scottsdale and was happy to walk around without any problems. Bill is another gentleman, 77 years old, said, I have no more leg pain, which was killing me before, from my hip to my ankle. That is completely gone. And of course, I have many other stories. One of my favorite stories was from a 94-year-old gentleman who was not able to have, or not a candidate for, any other back surgical interventions. And really all he wanted to do was just go to the grocery store and be able to walk through it. And after, 1 week after we placed this device in him, he came back to my office and told me that he walked through the grocery store, and that was, fabulous and was wonderful. And, I was really happy to be a part of helping him just accomplish some real life, real world, activities that he was having a hard time doing. Next slide, please. There are, of course, other pain management options that we use for back pain. So this slide is showing one of those. It's called a spinal cord stimulator, and I performed this procedure as well. A stimulator can be good for patients who maybe don't necessarily get relief when they lean forward. This device is another surgically implanted device. As you can see, there's a little controller here, and so it uses electricity to stimulate the spinal cord and nerves and alter the pain messages that are carried through the spinal cord. It is a well-established therapy that has been proven to be safe and effective. Of course, FDA approval with this device. These spinal cord stimulators every year seems like they improve and get better. This little graph that you see on the right side of the screen is just showing that after 2 years, there is significant pain reduction with using this device. Next slide, please. Another option is something called a radiofrequency ablation. And so this procedure is done well, I do it in my, it's called the spine center, or my outpatient injection suite. This procedure is not an implanted device. This procedure is done just through needles. It's not a surgery or anything like that. If you've had an injection in your back, you probably have an idea of what it's like to get a radiofrequency ablation. What you do is you would come in, you would lay on your belly. Folks can be sedated if they need to, or a lot of times people don't even need to. We just numb up your skin, and then we use a special needle where 1 centimeter of the tip of the needle heats up and burns these little nerves called the medial branches, which carry the pain signal from the facet joints in the back. So this procedure is good for people who have back pain that's really not involving the legs and is coming from arthritis in the facet joints. Next slide, please. A couple frequently asked questions here. I'll just kind of run through some of these. If I've had prior treatment done, like a back surgery or an ablation or a stimulator, am I still a candidate for the Vertiflex procedure? The answer to that is it depends on exactly what you had done. And so, you know, we would have to have a consultation where we would review your MRIs or CT scans or X-rays and figure out if it was a good idea to have the Vertiflex placed. Does it require a hospital overnight stay for the Vertiflex procedure? No, that's just an outpatient procedure. I think I mentioned that earlier. You go home the same day. Is it covered by Medicare and Medicaid? Yes, both Medicare and Medicaid cover this procedure. What is the recovery time? As I mentioned, you know, 1 week, no shower, and then 4 to 6 weeks, we ask you to avoid bending, lifting, or twisting. Will I be able to get, actually, let me change my screen around here. Will I be able to get imaging done or go through airport security? Yes. So the device does have metal in it, but it is compatible with most MRI machines and will not set off you know, metal detectors at the airport. If you need, and we usually provide this to everybody, you'll get a little card that says you have, you know, a medical device implanted in your body, and so, you know, you get the airport screening people will know that, and it won't be an issue. Does this restrict your movement? From my personal experience, I have only found that the Vertiflex device improves movement and mobility. I've never had anybody tell me that they felt like they couldn't stand up straight or they had any sort of limitation with their range of motion. Next question is, does it relieve pain immediately? Some folks do find pain almost or in some cases, the very same day as the procedure. There also can be some folks that it may take a few weeks or up to 6 weeks for that nerve to kind of get used to not being pinched and have some of that inflammation settle down to where they will find pain relief. Of course, you will be sore from having, you know, the surgical incision in your back that usually can take a few days to get better. Next slide, please. All right, so, you know, hopefully I've introduced you to a few different ways of being able to just get back to some of the normal activities that help enhance your quality of life. You know, whether that's tennis or swimming, or as with the older gentleman, just simply being able to make it through the grocery store, or, you know, get through house chores, or, you know, running the vacuum, things like that. You know, Vertiflex procedure and some of these other pain procedures can really be life-changing and help folks get through their daily activities. Next slide. Again, I want to thank everyone for taking these few minutes to listen to this presentation. And if this applies to you, or if you feel like anything in this presentation applies to you, please don't hesitate to make an appointment. My address and phone number are listed here. I'll read it out. It's the phone number is 317-528-8494. And you can get in, you'll get a secretary, but they'll get you set up to be seen for an appointment. If anyone happens to have any questions, there is a chat function within this presentation. I think we'll give a few minutes right now to see if anybody wants to type in a question. But other than that, I think that's the end of the presentation. There may be one more slide that has a few references. I'll ask for that to change slides. We'll see. Oh, maybe not. Oh, that's okay. Like I said, if you have any questions, please type them in. We'll wait maybe just a few minutes here to see if there's any questions. But other than that, thank you so much for taking just a few minutes to listen to this presentation. And I hope you have a great day. We'll wait like I said, just a few minutes to see if there's any questions, but thank you again.